So today I have a follow-up visit with my urologist. Obviously, this is the doctor I've probably seen the most because of this PSSD situation and what bullshit and fuckery pursues after Zoloft. But yeah, this visit, this doctor's actually pretty good. He's willing to work with me. I think he's one of the better doctors, and he's actually willing to let me try some things. He doesn't discount my situation with the antidepressants. I've been pretty clear to him, that I feel like it's related to the antidepressants, and he understands that. And so he's willing to think outside the box and allow me to try a few different things, and we'll see how it goes. All right, so I'm just leaving the urologist now. Last doctor I seen was a neurologist, and basically, I got diagnosed with that autoimmune disorder, so now I gotta go see a rheumatologist for that, and then not sure what the treatment's gonna be for that. But so, have a bunch of doctor's visits here, and today was another one with the urologist, and was a follow-up from my last visit. And basically, there's basically no new information here about that. I updated with him that I have this some minor nerve damage from having this autoimmune disease or whatever, and so he's aware of that, and so he's also aware that I had the gyno issues after doing the TRT stuff, and then my regular doctor recently checked my T levels, and they were kind of low at 390 when they used to be 650 before I tried the TRT stuff. So the urologist is sending me again for more testosterone and estrogen testing to see where I am with that, and then to see if maybe I should try like Clomid or enclomiphene or something like that to maybe jumpstart it again or something. And an interesting thing that I have been researching is PT-141. That's a peptide, and it's actually FDA approved for women for like libido and things like that. So, and I wasn't sure if it was approved for men as well, but this doctor's kind of cool. Like, he actually is working with me and listens, and I feel is like trying to come to some sort of positive conclusion for me. So I brought that up with him, and he said it's a possibility. I guess the game plan right now is I stopped taking Cialis back in like beginning of January, and that's because I was having some visual issues, and then I kind of researched Cialis, and sometimes people that take it can have like side effects of vision disturbances and stuff like that. So I just stopped taking it to kind of rule that out, and my vision hasn't gotten any worse or any better, so I don't think it affected it. So his game plan now is go back on like daily Cialis, and then maybe use a little bit more, like if I'm getting ready to do it or something, and kind of go from there. Follow, do this blood test and follow up with that. And so he told me, as far as the PT-141 goes, he's willing to let me try it, but it's not covered by insurance, so it's out of pocket. So he said it could cost $100 to $200, a month or something like that. And I basically told him, like, hey, at this point, with the lack of brain and genital connection that I've been having, I'm almost willing to like pay that amount to see if it does anything, And he's like, yeah, it has been known to do that, and he was telling me other people try like what did he say, like oxycodone? I don't know if he said oxy or I don't know, some other drug that starts with an O that basically can give you like some sort of like dopamine effect or something like that. So that's interesting, and actually, I feel better that it'll be under the supervision of a doctor, and that is also allowed for men. So he's willing to try that, and he says he's willing to try other things as well. So I guess that that makes me feel good that I could try that and see how it does. I'm gonna actually do a little research and find out if I'm gonna go on like Reddit and things like that and see if like other people that have PSSD, what their experience has been with it, and kind of read up on it a little bit. I mean, I've done a little research on it and watched videos on it and things like that, and I'm at this point where I basically have been 8 months without any kind of libido, or like very minuscule libido, I'm desperate. I mean, at this point, I'm like fucking dead. I might as well try anything. I can't be one of these people that like goes 30 years in this condition with no improvement, not trying anything. Like, no, I can't. There's no fucking way I could do that. So, the other thing too is, the most promising thing that I've ever done that has actually gave me some relief has been a gut protocol. And recently I tried that force factor test X180 or whatever, and that kind of like made me jittery and stuff like that. So I'm moving away from that. I had to stop doing that because it was affecting my sleep too greatly, which I've had a couple of good nights sleep since then, since I've rebounded off of that. But I started doing oregano oil and peppermint oil capsules again. I haven't introduced probiotics yet. I'm gonna kind of refresh myself on what the proper way to do that protocol is and try that again. The previous time where I tried it, I basically did like oregano oil every day for like a month and a half, and then I started doing the peppermint oil with it, and then after a week of doing that is when I introduced the probiotics, and then within 4 days is when I started that window of 12 days where basically sexual function was back to normal and things like that. So I'm trying that. I guess I'm trying the gut protocol now at the same time. I'm gonna start taking daily Cialis again, and then maybe in a couple of weeks I'll hit this doctor up. He said I could just message him on the My Chart or My Care or whatever, and I don't have to come back in. And then he'll if I want to try that PT 141, he'll let me try it. Obviously, I got to pay for it out of pocket. So that's interesting. That'll be something maybe you could watch the channel for, and I'll, if I try it, I'll definitely post my experience with it and how it works and any side effects and things like that. So that could be something interesting to look out for. And next, aside from this, I got to follow up in 2 months with the urologist again. And the next thing I have now, according to the neurologist, is an MRI of the brain, which I'm doing Thursday. And hopefully that'll detect any, brain abnormalities, or I don't know what they're looking for. But so I'm doing that on Thursday, and then I'm following up with the rheumatologist that deals with the autoimmune syndrome, which would be the likely person to prescribe any sort of treatment for it. So we'll see. And then some of these treatments that are for it, like the corticosteroids and stuff like that, like I don't know if I would, you're not supposed to do those like long term, and it lowers your testosterone and it has side effects, which this doctor, the urologist even indicated that it could have negative sexual side effects. So it's like, I don't even know. Why would I want to try that? Like, I really wish they would just let me do the fucking IVIG infusions, which would lower the inflammation, and I would do that like once a month, and that's what people have shown to have like gotten better with. So, but maybe they won't let me just do that first. Maybe I gotta try these other things first. But yeah, I guess little steps, and I mean, this life is horrendous. This life is horrendous in this state, and the only thing I constantly think about is my condition. Every time I go to the bathroom and I look at my penis and it's not what it used to be, and it's like different color and different shape and different flaccid size, and it's a constant reminder. Even when I'm sitting, I could feel that my penis is different. I mean, it used to like be more full and just like right along my leg and stuff like that. Now it isn't. Now it's like more retracted and like smaller and thin and stuff like that. It's a constant daily reminder that I have fucking PSSD and that my life is fucked up. And not only that, can you imagine? I go to the gym a lot, right? I go to the gym every day. And I walk past hot girls. I look at their amazing asses. Women are beautiful, and I could acknowledge that. But my libido is like fucking like 5%, right? So I acknowledge that they're beautiful and stuff like that, and it just pisses me off. It's like I'm in this fucked up position where I'm not operating at optimal level here. I can't operate with the same confidence and stuff like that, and I'm in a less than optimal position right now. So it's like I live in a constant reminder that my life is fucked up. So I have to like spend every moment of every day, I tend to my kids and I spend my time with them when I have them and stuff like that. But even when I'm with them, in the back of my head, this is fucking lingering that I have this and I'm not normal, and this is my life now, and I can't accept that life. This is not a life I can accept. This is not who I am. This is not who I want to be. I am ready to move on with my life, being divorced and ready to date people and stuff. And I don't want to be hindered by this fucking bullshit. You know what I mean? So you could just imagine. And I'm sure if you have PSSD, you know what I'm going through. So that's why I make these videos. It's not just to help myself, but to help others as well, you know? So, you know, it could be like useful information, what people might go through, and how many doctors you're going to have to see, and what some of their, you know, remedies might be for what you're experiencing, or what they might say, or what your interaction might be with them. So, you know, feel free to use this information, and maybe it'll help you along the way, or maybe you can point other people with PSSD in the direction of my videos and my experiences, and hopefully we can help each other. So yeah, hit the like, share, and subscribe button to keep these, you know, these videos going and helping people out. And I'll let you know how my appointment goes Thursday with this MRI. Maybe I could let you know what an MRI is like if you don't already know, and we'll go from there. Just keep the testing going and keep trying stuff, because we can't give up.